Fire, a most dreaded enemy. In Atlanta, Georgia, a hotel fire claimed 119 lives. Hartford, Connecticut, a circus tragedy that could have happened in your town. 107 dead and more than 400 burned and injured. 491 died, and many more were burned in the Coconut Grove fire in Boston. The city was pressed to capacity in order to treat the burn patients. Over 90,000 were killed, and over 38,000 more were burned and injured in Hiroshima from the first atomic bomb. Who can calculate the toll a mass atom bomb attack would take on your city, on your hospitals, your doctors, your nurses? With many hospitals knocked out, and with a shortage of doctors and nurses, we do know that every available volunteer will be needed to help the burn sufferers, the wounded and dying. You, as the volunteer worker, will be counted upon to help. There are 3 possible locations in which you're likely to assist. 1, in the devastated area where you might be working as a rescue or first aid worker or stretcher bearer. 2, or in homes where thousands of casualties, especially those with minor burns, must be cared for with little or no medical help at first. But whenever possible, get urgent cases to medical attention quickly. Three, or you might be working in a medical station under direct medical supervision. The greatest problem will be the care of burn casualties. The critical cases especially need early medical attention. Urgent cases are those where burns extend over a large area of the body. For instance, if an area of the body as great as the size of an upper extremity is burned, the case is surely serious, and the shock hazard is great. And if there are burns of the face, if the nasal hairs are burned and there's coughing and hoarseness, the case is also serious because the respiratory tract may be damaged. For all burn cases, follow these 3 basic rules. Relieve pain, prevent infection, give first aid for shock. Rule number 1, relieve pain. Pain will subside if you exclude air. The ideal way to relieve pain by excluding air is to apply a thick, dry, sterile dressing. The Subcommittee on Burns of the National Research Council recommends this method for first aiders. Butter, other household remedies, and burn ointments may relieve pain, but they may also contaminate the wound and interfere with later medical care. Even though your applicator, the handle of a spoon, is sterilized, and the ointment you use is a good one, such as sterile petrolatum, contamination is still possible. Remember, what may look to you like a first-degree burn at first may develop into something much more serious. Blisters or deep destruction may appear later. Use of ointments on extensive and deep burns is especially bad. Rule number 2, prevent infection. In making your examination, be careful not to touch the burn area. Make sure the patient does not. You can protect the burn against contamination by applying a dry, sterile dressing. Ideal dressing materials are sterile gauze dressings or special burn pads. Roller bandages, triangle bandages, elastic bandages, or adhesive tape may be used to hold the dressings in place. Rule number 3, give first aid for shock. Burns are particularly likely to cause shock. At first, shock may not be noticed, but do not be misled. Try vigorously to prevent it. Make the patient lie down. Cover him adequately. Raise the foot of the litter or bed. Encourage the patient to take a glass of warm water every hour at first, but if nausea develops, discontinue temporarily. Your medical supervisors may direct a salt and soda solution be given in preference to plain water. This solution consists of 1 teaspoon of salt, a half teaspoon of soda, to a quart of water. Sometimes the patient can take fairly large amounts of this solution. Do not use a hot water bag or any other form of external heat to cause the victim to sweat. Overheating is bad. Care for all injuries. If an extremity has a fracture as well as a burn, after the burn has been dressed, splint the fractured part. Always check for other injuries besides burns, such as fractures, lacerations, and crushing, and give them proper attention. Many such additional injuries will be present and may require prompt medical care. Always try to keep the patient cheerful. When you're assigned to field work, remember urgent cases come first. What you do in the field on rescue missions should depend on whether medical facilities are readily available. If they are, simply cover the seriously burned and transport by stretcher. Mildly burned cases can walk. If medical care may be delayed for many hours, or if the weather is bitterly cold, you may have to protect the burned parts by dry dressings applied in the field. Remember, your main duty in the field is to get urgent cases to a medical aid station as quickly as possible. However, when immediate first aid is required, your training and judgment might dictate that you give first aid in the field. Your work as first aiders in the medical station, however, will be under the closer supervision of a doctor. Doctors in first aid stations will be worked beyond their capacity. That means that you must help, following their directions. Make the patient comfortable, provide adequate covering, and give the victim assurance that you will take measures to locate the family. With hospitals and medical stations overburdened, and with the enormous demands upon the available doctors, you will be called upon to assist in many ways. To take pulses, watch transfusions, and apply dressings, particularly for minor burns. Let's have a doctor show us how to apply a sterile dressing to a forearm burn. Expose it gently and place a sterile gauze dressing on the burn. Then apply the bandage. We're using a 3-inch roller bandage to illustrate. Do not apply it too tightly or the blood circulation may be affected. In a large burn, one involving most of an upper extremity, first expose the burn gently. Then apply a dressing. In this instance, a special burn pad. Make it comfortable and be careful to avoid wrinkles in the dressing. Apply a bandage. In this case, an elastic bandage is being used. If debris is present, as occasionally occurs, remove it only if you can do so safely. Now let's apply a special burn pad on a burn of a lower extremity. This burn pad has been cut with the sterile scissors in order to fit the contours of the leg and foot. These burn pads in large and small sizes are now being stockpiled by the civil defense authorities. Note how the doctor bandages around the ankle and foot. Use enough bandage to completely cover the burn pad. In bandaging the victim, keep motion of the extremity to a minimum. Be gentle. These burn pads are thick enough to relieve pain effectively and may be left in place for many days. If the trunk is badly burned, the dressings should be applied by a physician. These cases are very serious. It is, of course, possible that you might have to dress such a burn using a large burn pad or other large dressing. For burns of the face, some physicians apply dressings, others do not. First aiders, therefore, should not apply dressings in medical stations to face burns or burns of the hands unless so directed. Small, deep burns of the face can be left open without dressing. A dry crust will soon form. In the home, however, a covering may be necessary if pain is intolerable. Sometimes the eyes are irritated from smoke. If so, a few drops of mineral oil will help. Flash burns of the hands will be common. Because of pain, you may have to apply a full hand bandage. If the burn is superficial, a dressing may not be required unless pain is intolerable. For deep hand wounds, it may be necessary to dress each finger separately. This should be done by a doctor. In giving first aid in the home, make the patient comfortable. If medical help is not available, it may even be necessary for you to dress the serious burn cases. Use dry, sterile dressings on deeper wounds. Do not change the dressings even though several days elapse before medical care. You may be obliged to use improvised materials. Use clean cloths, preferably freshly ironed, such as hand towels, bed sheets, pillowcases. Avoid materials that come in contact with the nose or mouth like a handkerchief. Bath towels are too rough to be placed directly over the burn and should be used only as outer bandages. A second bath towel can be used as additional protection and secured with safety pins. Let the doctor show how to apply an improvised dressing to the leg. He places a freshly ironed towel next to the skin because it's soft. Now, a bath towel. Then bandage, this time with roller bandage. Use improvised strips of cloth if roller bandage is not available. Guard against bandaging too tightly. An important point concerning burns is to keep the patient from moving the injured part of the body. To combat shock and aid in blood circulation, elevate the injured extremity by raising the foot of the bed. Feed tasty, nourishing food, especially protein foods. Meat, milk, eggs are recommended for burn casualties. In case of great catastrophe, radio advice will be given by doctors for the benefit of first aiders caring for casualties in the home. Do only what is necessary. Follow their advice whenever possible, and at all times remember your 3 basic rules: relieve pain, prevent infection, give first aid for shock. Here are some pictures of actual burn cases. This person had first and second degree burns of the face and made an excellent recovery. Here is an extensive burn. As first aid, fit the dry dressing carefully. Cut and apply extra pieces as necessary. Note the blisters in this burn. When you apply a dressing snugly, as you should, some of the blisters will rupture. Do not break open blisters before applying a dressing. Blisters sometimes become extremely large. Swelling of the injured part often occurs, as you see here. This case also had an excellent recovery. Here is the same pair of hands a month later. If you get victims to medical attention in good condition, even bad cases may have a surprisingly good recovery. An ointment on this severe burn as a first aid measure might interfere with later medical treatment. Germs may be planted on the burn. Unsterile material, obviously, should not be used. The same hands also a month later. Knowledge that modern medicine achieves recoveries like this benefits the morale of burned victims. Shock is a great danger in extensive burns. Such victims need prompt medical care. In case of great disaster, you can greatly assist victims like these through applying first aid wisely.